Welcome to the GoalZero Toolbox Talk series. Today's Toolbox Talk: Cardiopulmonary Resuscitation, CPR. A cardiopulmonary resuscitation, CPR, is an emergency procedure consisting of chest compressions often combined with artificial ventilation to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. It is recommended for those who are unresponsive with no breathing or abnormal breathing. CPR alone is unlikely to restart the heart. Its main purpose is to restore the partial flow of oxygenated blood to the brain and heart. The objective is to delay tissue death and to extend the brief window of opportunity for a successful resuscitation without permanent brain damage. Administration of an electric shock to the subject's heart, termed defibrillation, is usually needed to restore a viable, or perfusing, heart rhythm. Defibrillation is effective only for certain heart rhythms, namely ventricular fibrillation or pulseless ventricular tachycardia. Early shock, when appropriate, is recommended. CPR may succeed in inducing a heart rhythm that may be shockable. In general, CPR is continued until the person has a return of spontaneous circulation, ROSC, or is declared dead. To give CPR properly requires formal training and regular practice. 1. Check the scene for safety, form an initial impression and use personal protective equipment, PPE. 2. If the person appears unresponsive, check for responsiveness, breathing, life-threatening bleeding or other life-threatening conditions using shout tap shout. 3. If the person does not respond and is not breathing or only gasping, call 911 and get equipment, or tell someone to do so. 4. Kneel beside the person. Place the person on their back on a firm, flat surface. 5. Give 30 chest compressions. Hand position. 2 hands centered on the chest. Body position. Shoulders directly over hands, elbows locked. Depth. At least 2 inches. Rate. 100 to 120 per minute. Allow the chest to return to its normal position after each compression. 6. Give 2 breaths. Open the airway to a pass-neutral position using the head tilt/chin lift technique. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Ensure each breath lasts about 1 second and makes the chest rise. Allow air to exit before giving the next breath. Note: if the first breath does not cause the chest to rise, tilt the head and ensure a proper seal before giving the second breath. If the second breath does not make the chest rise, an object may be blocking the airway. 7. Continue giving sets of 30 chest compressions and 2 breaths. Use an AED as soon as one is available. Minimize interruptions to chest compressions to less than 10 seconds.